Welcome back to your Pediatric Dentistry channel Tiny Teeth Talks. If you are new to this channel, subscribe the channel, and for details of this channel visit the bio section, or you can also check out my first video. Sorry if there is any mistake in videos or shorts. Today's topic or question is effect of parental attitude and parenting styles in pediatric dentistry. Not so important, but you have to read everything during exams and you should have knowledge about each topic. It might help you during your practical and while treating patients, because as we already know and as I mentioned in previous topic, that parents' behavior or attitude has an effect on child's behavior. First, you have to make an index including headings and subheadings followed by references, must for the students doing masters. So, according to the developmental psychologist Jerome Kagan, parenting is defined as implementing a series of decisions about the socialization of children to guide the children's social development. According to several authors, negative child behavior could be associated with the parental personality traits and maternal anxiety, as I already mentioned. According to Aminabadi and Farahani, there is a significant relationship between parenting styles and children's behavior during dental treatment. Bumrin gave the three parenting styles: authoritative, authoritarian, and permissive parenting. McCoby and Martin in 1983 add fourth parenting style, which is neglectful or uninvolved. According to the Simon Gamer classification, there is a 0 to 5 different type of parenting style. So the 0 is indifferent, they do nothing, even doesn't matter for them, neither approval nor disapproval, neither question the dentist nor they respond. The first one is dominant. They respond to the dentist, challenge the authority of the dentist, question the treatment plan, and overrule the authority of dentist. So basically they reverse the decision made by dentist. The second is doubtful. They respond to the dentist action, question the treatment plan, and express the doubt. So basically they are doubtful in nature. The third is reasonable. They respond to the dentist interaction in a respectable manner but do not follow the treatment plan blindly. Instead voice their questions though in a hostile manner, and when convinced follow the direction cooperatively. So basically the dentist have to convince them. The fourth one is a submissive. So they respond to dentist interaction in a respectful manner. They do not question the dentist treatment plan. They idolize the dentist and show the utter surrender to the dentist decision. So basically they obey the dentist decision. The fifth one is apprehensive. So they respond to the dentist but show sign of anxiety. They may put up lots of questions or none at all. So basically they are anxious parents. Now you have to explain as many type of parenting as possible. So starting with the authoritative parenting. They have a high expectation but at the same time they are warm and responsive. They set rules and boundary by having an open discussion. They encourage the independence, show their affection and supportive behavior. They also allow the bi-directional communications, also known as a democratic parenting style, democratic parents. According to Boomerang, this style helps the children in achieving higher academic success. They are high demandingness, high responsiveness, and the child has a good self-esteem, better mental health, less violent tenderness, appear happy and independent. The second one is authoritarian parenting. They show harsh parenting practices, including physical punishment, yelling, and commands. They have high demandingness, low responsiveness. Their child has a low self-esteem, more prone to mental issue, more behavioral problems, unhappy, less independent, and worse coping skills. Basically the reverse of authoritative parenting. The third one is the permissive parenting. They have a very few rules and boundaries. They do not enforce the rules. The children's freedom and autonomy are high valued. This parenting style is most popular in middle class rather than in a working class family. They have a low demandingness and high responsiveness. The children cannot follow rules, worse self-control, encounter more problems in a relationship and social interactions. The fourth one is the neglectful parenting or uninvolved parents. They do not set high boundaries or high standards, emotionally and physically absent, often a large gap between parents and children with no regular communications. They show a low demandingness, low responsiveness, and the child is more impulsive, cannot self-regulate emotions, and more mental issues. The other parenting styles are the attachment parenting. They related with the authoritative parenting, balance high expectation with empathy, so they get best outcome. Parents create a positive, warm, and safe environment so the children can develop trust, closeness, and give the child enough time to feel comfortable and familiar with the world. This parenting style might be misinterpreted with the permissive parenting, but no. In permissive parenting, no rules, no boundaries, but in this, they have a rules and boundaries with freedom. They focuses on babies' early years. There are no references to the parents' high demands, and the child is more cognitive competence, better communication, and healthier social emotional development. The helicopter parenting. Parents demonstrate appropriate involvement in improving their child's personal and academic success and continue throughout the life. That might lead to the negative consequences. Basically, the parents always interfere even after become adult. So parents experience extreme separation anxiety and more like authoritarian parenting because they are very harsh to child. They decide everything for the child. Children may show low self-esteem, fear of failure, more like to develop mental and physical disorders and difficulty in developing coping skill. Tiger parenting. This is basically seen in a Chinese mother, and after the child become adult, it transferred to the father. So authoritarian type of parenting, and parenting style is shown during early adolescence period and late adolescence and adulthood, father occupying mother's role. Children show low academic performance and display depression. The free range parenting. This is directly opposite to the helicopter parenting. They do not interfere basically. So less protective approach in parenting style, less supervision, less control, and more freedom. Children might become spoiled, would not take orders from anybody, right to make decisions. Nowadays spend additional time indoors on sedentary activities. Sedentary activities means little or no physical activities, which increase the screen time, which leads to the childhood obesity and a range of other developmental issues. The other one is concentrated cultivation parenting. So they foster the children's talents by incorporating organized activities in their children's life. Start to encourage their child to learn how to speak with adults. Children see adults as their equals, express greater power in social situations, disrespectful behavior toward the authority figures. Little emperor parent. The little emperor syndrome is an aspect or view where the children of modern upper class families gain excessive amount of attention from their parents and grandparents, basically over pampered child. Parents' general desire for their children to experience the benefits they themselves were denied. It's only applied to the urban communities, and children might get spoiled, submissive, easily irritated, and anxious. Gentle parenting. This parenting is an evidence-based approach to raising happy and confident children. It composed of 4 main elements: empathy, respect, understanding, and boundaries. It focuses on fostering the qualities you want in your child by being compassionate and enforcing consistent boundaries. It also encourages discipline on teaching valuable life lessons rather than focusing on punishments, and children are well behaved, happy, and cooperative. The child-concentric parenting. Families' day-to-day activities and life revolve around the child's need. Parents attuned to the physical, emotional, spiritual, and psychological needs of children, and children may be spoiled, over-pampered, cannot preserve and cope up with difficulties, less cooperative in dental settings, so they are also over-pampered child. Soccer parenting. The parents provide all type of facilities to the child. Child become introvert, and they might show the stoic behavior, tense cooperative behavior during dental treatment. Guilty parenting. Parents lives in guilt for their past deeds that cannot fulfill their children's general and dental needs, so they keep a track for best dentist and hospital around, and children might throw temper tantrum, be overconfident, and search for outward validations. Snowplug parenting. It also known as a lawnmower parenting. Lawnmower basically cut the grass, and same in this type of parents, they remove the obstacles and the problems in their child's way. Help and save their kid in almost every situation, like a snowplow clears all the snow from the road. Children may trouble dealing with the frustration, poor problem solving skill, lack of self-efficacy, increased anxiety, prefers treatment under sedation. Lighthouse parenting. So the parents balance between the free range and the helicopter parenting. Children are given autonomy at very young age to do things on their own, but they balance between the independence and dependence, focused on providing stability, allow life to be experienced like a boat, but always visible and available to guide like a lighthouse. Acknowledges children's growth and change. So children are more academically successful, take the fewest risk, self-reliant, display self-confidence, have the closest relationship with their families. Spiritual parenting. Respecting a child's individuality and creating the space for the child to develop their own belief based on their unique personality and individual potential. Helping the children to stay centered within themselves and helping them to realize by themselves. Religious and spiritual struggles are related to mental health in various negative ways, and children whose parents are emotionally responsive will have a less religious struggle. Toxic parenting. This is a destructive parenting style that exhibits the guilty, humiliation, low motivational levels that can obstruct a child's performance throughout life. Neglecting children's need to direct physical, emotional, and sometimes even sexual abuse, and children shows the severe guilt complexes and insufficient level of self-esteem. This type of practice failed to nurture the psychological and emotive necessities, impacting the children's survival skill. Crunchy mom. A woman searching for more information by doing extensive research and proceeds with her own decision. Basically, the crunchy mom, the mama search every detail and then take the decision. Support the natural options like home birth, breastfeeding until child wins by themselves, anti-vaccinations, and prefer natural or holistic medicine to minimize the exposure of chemical toxins. Alter and adjust lifestyle for environmental reasons. Silky parents. It is a Western parenting styles which is reverse of the crunchy mom styles. They support the hospital birth, bottle feeding, disposable diapers, etc. Follow the advice of established medical authorities. Moms who use sleep training methods like crying out and rely on modern products for convenience. Combination of both silky and crunchy parents. Coming to the narcissistic parents. So, pervasive pattern of grandiosity characterized by intra and interpersonal strategies to protect self-esteem. Basically, pervasive pattern of grandiosity is a characteristic of narcissistic personality disorder. They have a consistent ongoing sense of superiority or exaggerated self-importance. And the parents are arrogant and lack of empathy, thirst for external recognition, and unconsciously use their children as a means to live out dreams. Excessively involved with their child and does not allow them to establish their own individual standards for success. Children left with a very little space to discovering their interest and potential that might lead to the failure in the parenting. The other parenting style is the generation-wise parenting. Gen X, Gen Y and Gen Z. So parents in between the 1965 to 1979 are called as a Gen X, 1980 to 1995 called as a Gen Y, and 1996 to 2010 is a Gen Z. Now we know that the parenting style changed the periodontics triangle. So the Gen X parents are equilateral triangle relationship. So there is the equal communication between the parents and the dentist and the child and the dentist. In Gen Y, isosceles triangle relationship. So there is a more communication between the parent and the dentist and little or no communication between the child and the dentist. And in Gen Z, right angle triangle relation. So there is a no or little communication between the parent and the dentist and more communication between the child and the dentist. In Gen X, parents has a constant watch but appear only when child need. In Gen Y, child has the first priority and give over importance to looks, and the Gen Z is negligent towards the child. The child become bold, respectful and well-mannered under the parenting style of Gen X parents. Child become pampered, selfish, disrespectful, easily cries and not able to face any hard situation under the Gen Y parenting, and the child has a less human values and respect when they grow under the Gen Z parenting. And these are the parenting styles we often shows in Gen X parents, and these are in the Gen Y, and these are in the Gen Z parents. So these are the references of the answer you have to mention must if you are doing masters. If you want this PDF or any other PDF, just like, subscribe and comment your mail ID with the topic and I'll send you the PDF. New videos on Thursday evening 6 p.m. and Sunday morning 11 a.m. Also, we try to put MCQs according to topics every day or alternative day on our shorts with the answer and the explanation if needed, which will help you in a Viva or NEET entrance exam. Like, share and subscribe the channel. Thank you.